record as well. All right, thank you everyone for joining us. My name is Ariani and I'm a clinical research coordinator for the Department of Mount Sinai Rehab for the spinal cord injury program. So we wanted to discuss today resources for people with SCI during the pandemic. As we all know, cases are rising again in New York City, and we wanted to just to remind everyone to follow precautions and to know the guidance for the upcoming holidays in New York City. Just in general, COVID-19 is a respiratory breathing illness caused by the coronavirus. The symptoms of COVID-19 are very similar to the flu. They include fever, cough, dry or wet, and shortness of breath, which may appear 2 to 14 days after exposure. Prevention of the coronavirus. We want to remind everyone to please wear a face mask at all times when in public, to wash your hands regularly with warm soap and water for at least 20 to 30 seconds, and to please practice physical distancing, avoid large groups, and staying home when possible. It's also important to know that you're not alone and you can access services or connect with your local SCI organizations via phone, online, and by other means. And we will give you those resources later on. We also recommend to keep 30 days of medical supplies and medication on hand. We don't know what the winter season will hold, so it's very important to just be prepared. Call your doctor before visit to let them know that you're unwell or have any health concerns. And please get the flu shot. It's still not too late. And although the flu shot will not protect you from COVID-19, it will help prevent the flu, which has similar symptoms to the coronavirus. Living with a spinal cord injury requires interactions, both solicited and unsolicited, that increase the likelihood of transmission. Therefore, we in the spinal cord injury community need extra hygiene precautions. A few of these include cleaning your assistive devices very often. Your mouth is essential and used in special ways, but it's also a route for transmission. Clean down your wheelchair, especially joystick and wheelchair armrests, trays, and push rims regularly. For those who are on BiPAP or use ventilators, which require cough assist or other breathing apparatus, you need to take extra hygiene precautions as well. We recommend that you do breathing exercises. Respiratory weakness makes for a worse prognosis if this infection does occur. So just, if you already do your breathing exercises, do them more often, do them regularly. And if you don't, it's never too late to start, especially if you're a high injury level. Please wash your hands often. Bowel management and hands contact objects that contact the ground, which increase our likelihood of transmission. We're always touching our wheelchairs, and we're also in and out of the bathroom doing our routines. So it's so important to constantly just be aware that you have to wash your hands. Attendant services. Caregivers should use PPE when coming into contact with you. Masks, gloves, and eye protection. And make sure that caregivers are also diligently washing their hands and not touching their face or your face. Caregivers should be washing their hands before and after coming in contact with you. And last, but we tend to forget, to please boost your immune system during this pandemic. UTIs, wounds, and other inflammatory processes result in immune suppression that weaken the body's ability to fight this virus. So prevention is important. Increasing pressure relieves, staying hydrated, eating foods that are high in antioxidants and probiotics like fresh vegetables, fruits, and supplements like vitamin D and zinc. And also, don't forget to exercise. Oh, sorry about that. Don't forget to exercise. It's important as well to boost your immune system. We wanted to share a little bit of emergency preparedness as well. Just things to keep in mind during this pandemic. Think about how emergencies may affect you. Emergencies can range from falls in the home to house fires to hurricanes. We think that these 3 steps are important and everyone should do it. Make a plan. If you know that you'll likely need help in an emergency, create a support network of people to assist you in advance, which includes family members, friends, neighbors, coworkers in your network. Discuss with them ahead of time the kind of help you need and make sure that there's a plan involved and you know who to contact if there is an emergency. Keep a list of emergency contact numbers near and know the location of the nearest emergency shelters. Not only that, but find out if those locations are wheelchair accessible. And as I mentioned before, gather supplies. Apart from medical and medications, have backup chargers and batteries for power wheelchairs, a backup manual wheelchair if possible, and extra oxygen and portable ventilators if you need help with breathing. Also, it's important to keep a copy of your prescriptions and a medical alert card with information about your medical needs in hand. On our website, there's a link for emergency preparedness where you can download an emergency card, print it out, and fill it out and just have it with you. We also wanted to share the emergency websites that are good and handy to know and to just having your favorites. The New York City Emergency Management, the New York City Management Outreach and Engagement Resources for Ready New York, and the Mayor's Office of People with Disabilities are important to know and just to be aware of these websites in case of emergencies. There's been an updated Thanksgiving guidelines from the CDC, and we wanted to emphasize these guidelines. So the CDC guideline says that the safest option for holidays is celebrating only with people in your household, or taking extra precautions like wearing a mask and keeping your distance if you celebrate with others. We recommend you celebrate with only people in your household. Cases are trickling up, and a lot of the people that are spreading the disease are asymptomatic. So even if you feel that, even if you are with someone and they don't have any symptoms, they might have the virus and you just never know. If traveling, check your local travel restrictions. Make sure that you're following those guidelines to whatever state you're going to. And also get a flu shot. Quarantine for 14 days before travel to be safe and to make sure that everyone around you is safe as well. Wear a mask. And if your friends or family outside, if you're having Thanksgiving with friends or family outside of your household, you should wear a mask. Keep 6 feet of distance from people. The CDC also recommends to bring your own plate, cups, and utensils and store your mask safely while eating and drinking. And other precautions are to open windows if dining indoors and to sanitize surfaces and wash your hands often if you're in contact with people out of your home. New York City has also updated, well, New York State has also updated the travel advisory update. The new guidelines can be, you can go to, you can text 692692 COVID, and you'll receive a link to one of the apps that you can download, and you can sign up to receive the latest New York City updates, just to keep informed, because the guidelines are constantly changing. The new guidelines for now are that travelers who are out of state for more than 24 hours must obtain a test within 3 days of departure prior to arrival to New York. The traveler must, upon arrival in New York, quarantine for 3 days. And on day 4 of their quarantine, the traveler must obtain another COVID test. So if you leave New York State, 4 days after, please make sure that you take a COVID test. If both tests come back negative, you may exit quarantine upon receipt of the second negative diagnosis test. And for travelers who are out of state for less than 24 hours, you do not need to test prior to your departure. However, you must fill out the traveler form and take the test 4 days after coming back to New York. Travelers from the tri-state area like Pennsylvania, New Jersey, Connecticut, Massachusetts, and Vermont are exempt from these guidelines, but they still must fill out the New York City travel form upon arrival in New York State. And this information is also in our website, which I will share later on as well. The new New York City update is that on effective November 13 at 10 p.m., bars, restaurants, gyms, as well as state liquor license establishments must be closed from 10 p.m. to 5 a.m. daily. Restaurants will be allowed to provide curbside food only pickup or delivery after 10 p.m., but would not be permitted to serve alcohol to go. And effective November 13, indoor and outdoor gatherings at private residences will be limited to no more than 10 people. You can download the app to get COVID exposure alerts and help protect your community while maintaining your privacy. That can be found at coronavirus.health.newyork.gov. I will also want to share the slides with whoever is interested. So just send in the group chat, just send me your email, or just let me know that you're interested, and then I'll share the slides with you. So all the links and information is there. We wanted to share our resources here at Mount Sinai. Video telehealth is still available. So Dr. Bryce and Dr. Wong and other SCI physicians are seeing persons with SCI who reside anywhere in New York for spinal cord injury care consultations through video telephone health. Video telehealth visits can be done from your home, and most insurance are accepted. You can call 212-241-6321 for an appointment. We also wanted to share with you our Mount Sinai spinal cord injury guides. They're available on our website at mountsinai.sci.org. We have a couple of guides. We have a guidance for a spinal cord injury community, which has a list of COVID-19 fact sheets, videos, webinars, and numerous national resources and links to stay up to date with COVID-19 related information that's catered to people with spinal cord injuries. We also have an adaptive and inclusive home workout guide, which includes physical activity guidelines for adults with spinal cord injury, which I think it's important, and a lot of people don't even know where to begin of how much exercises they need. And there's a guide there that breaks it down depending on the level of your injury. There's also a long list of free virtual classes that includes exercise, yoga, dance, and a whole bunch of YouTube video recommendations to work out that you could do at home. We also have a nutrition and spinal cord injury resource guide. There's numerous spinal cord injury infographics related to nutrition, and there's links to webinars and videos. There's also a paraplegia and tetraplegia daily calorie intake guide and lists for adaptive cooking tools, tips, and national resources. Our last guide includes mental health for people with spinal cord injuries. There's a list of mental health fact sheets, list of local support groups, hotlines, and meditation videos. So I recommend everyone, if you haven't gone, to go and check it out. There's so much information there to keep you busy while you're home. I also wanted to share our spinal cord injury virtual groups. We have many groups weekly going on right now, and they're all virtual, all on Zoom. On Mondays, we have our meditation group from 12 to 1. Tuesdays, we have our fitness exercise class from 2 to 3. And then Wednesdays, we have the spinal cord injury transition support group, the Women on Wheels support group, and the family support group. Thursdays, we have virtual Zumba from 5 to 6 p.m. And on Fridays, we have the spinal cord injury peer support groups at noon. All this information can be found on our website, mountsinai.sci.org, with information about each class and the links for you to join. I wanted also to share our research that we have right now, impact on COVID-19 on individuals with spinal cord injury. The purpose of this study is to determine how COVID-19 has affected the SCI community, whether or not you have personally had COVID. It will look at how COVID-19 affects a person's health, both physically and mentally, as well as how it affects services that they need. It's pretty much a 10 to 15-minute questionnaire, and it can be conducted online or over the phone, depending on what you prefer. You can visit www.sci./SARS/CoV/2.org, or you can also go to our main website, www.mountsinai.sci.org. All the information is there. You can also reach me at ariani.ramirez@mountsinai.sci.org, for more information, or if you want to sign up for the study. We also wanted to share our local programs and services here in New York City for people with spinal cord injuries and for the disability community in general. The Mayor's Office for People with Disabilities has been gathering information specific for people with disabilities on the resources available to the New York City's population response to the COVID outbreak. So there's a huge list of resources, specifically for people with disabilities, and there's a guide there for different information depending on the topic. So for food and supplies, there's information on the Get Food New York City program, meal pickup programs, meal delivery programs, and there's links to the Invisible Hands voluntary delivery. So if you're having trouble going out and getting food, grocery shopping, things like that, you can sign up for Invisible Hands and they will go shopping, pretty much go shopping for you and deliver your groceries. There's also custom hours for people with disabilities in different stores and supermarkets. So they have a list there of which stores have that option. There's also just a regular information about social services and Medicaid benefits. There's a list of home health care providers, information about where to go if you have a lack of access to PPE, and if you need clear face masks. There's also just information specific to people with disabilities regarding to reduce fare metro cards, Access-a-Ride, and accessible dispatch. There's also a list of resources for housing and some programs that the New York State has available for people with disabilities that you may not be aware of, like the Disability Rent Freeze and Tax Exception Program, the Homeless Shelter Accommodation, and Project Open House. So there's a whole bunch of information there that is available and that everyone should be informed about. There's also employment information, the program New York City at Work, which is an employment opportunities for people with disabilities. They help recruit and they help with your resumes if you're looking for employment. A couple of the other resources there are a list of mental health resources for people with disabilities, information on the barrier-free relief program, and there's Empowered New York City program information on that, which it's pretty much a financial counseling program for New Yorkers with disabilities. They also have an accessible virtual activities page that lists virtual activities, toolkits for people with disabilities, and so much more. So for a list of the complete resources, you can visit this link, and it's also on our website. We also wanted to share just more programs and resources that everyone should be aware and informed of. If you need information of just about medical information, there's the Mount Sinai Coronavirus Facts and Resources website. There's also information about our visitor policy and fact sheets for protecting yourself from COVID-19. Some other helpful resources are the Center for Disability Rights, and that's specific. I wanted to include that there. They have action steps for attendance service users in response to the pandemic. There's information of what to do in case that you need help with finding an attendant or the steps that your attendant provider should be doing during this pandemic. Also, the Access Project, they have a list of online workouts and classes that you can take. But apart from that, they're also taking requests for PPE supplies and exercise resistant bands. And always, I would recommend, for the latest, most up-to-date information, to visit the Center for Disease Control and Prevention website, the CDC. And the Christopher and Dana Reeve Foundation have a really good website with information of the coronavirus and spinal cord injury. And they also have monthly webinars that are related to SCI and the pandemic. So that is pretty much everything that we wanted to share. Now we're just going to open it up for comments, questions, and Dr. Spunberg is here to answer any of your questions or concerns.
Thanks, Ariane. Actually, I could, if you want, I could say a few things.
Yes, go ahead. Yes, please.
Can you see me? I guess it doesn't really matter, but are you able to?
Yes, yes, we can see you.
Okay. All right. And you can hear me, no issues?
Yep.
Okay. So thank you. First of all, that was fantastic. Thank you, Ariane, for putting all of this together and organizing this material, which is very helpful. And also for arranging everything with rescheduling this after last week. So I think, so I think those resources that were mentioned on the previous slides, which can be sent out, are very, very valuable. From my standpoint, first, let me just introduce myself. I'm Dr. Spunberg, Daniel Spunberg. I'm the Spinal Cord Fellow. I work with Dr. Wong, Dr. Bryce, Dr. Escalon, and some of you I think I've probably met, others maybe have not yet, but I work with the physicians that you probably do know. A couple things that stood out to me, or that I just want to point out from a medical standpoint that might be helpful. You know, this is a sort of unprecedented time where we have to be much more careful and cautious, and no one more so than individuals like yourselves who have spinal cord injury for various reasons that were outlined. The things that stick out to me, I think a big thing is that respiratory management. So, you know, depending on your level of injury, obviously is going to determine what your deficits are. And so your higher level cervical injury, this becomes more obviously of an issue. But I want to enforce the importance of coughing to clear your lungs out, maybe even more regularly, to do incentive spirometry. If you have received an incentive spirometer from being in the hospital, or if you have one, that always helps in general for all patients to open up the airways and to allow oxygen to be delivered to your blood more effectively. So it's very important for the ventilation perfusion, and can be helpful during the period where you're trying to prevent yourself from having any of these infections, but also if you happen to have coronavirus, it's helpful, or any kind of inflammatory process, it's helpful to maintain that adequate respiratory functioning. For a couple other things that are unique for those of you with spinal cord injuries, is being conscious of the things that you're touching that maybe you don't always recognize, like with your wheelchair, different parts of the wheelchair, like when you're using the rims, you want to try to wipe those down and be very aware of when you're outside and coming back inside that you potentially may have, you know, contaminated or had theoretically so viral material there. So you want to be very good about trying to clean those areas. For some of you, higher level injuries, you use your mouth a lot of the time to assist yourself in different activities. And obviously that's critical for you in various different purposes of getting around or communicating. But you want to be very, very actively aware of more than ever of when you're doing this, when you're not inside your house and when you're exposed to other people. to just try as hard as you can to clean whatever devices you're using, and to, I guess, just be a little bit more careful in the types of mouth-assisted things that you're doing when you're outside of the community. Also, generally, I think exercising at home, which was mentioned before, is more of it was already something that we highly recommend to be doing, because it ultimately is on you to keep up your exercises, stretching, range of motion, and whatever else you need to do, so that you don't rely only on therapy sessions. But this is more obviously relevant than ever now that most of you are even unable to go for outside sessions. So really want to point out the importance of trying to hone in on keeping up those home exercises. There's been, with COVID-19, there's been obviously a lot of research over the last 8 months. We're getting closer towards a vaccine, which is fantastic. There's really good reports from the Pfizer vaccine with over 90% efficacy, and it's very safe. And the Moderna vaccine they're talking about is probably going to be also very effective. So we're on the horizon of receiving hopefully very, very good news, but it will take a long time for the country to be able to really effectively distribute the vaccine. So even for myself and others in healthcare, I don't anticipate this happening yet. I think we're looking into next year and hoping that in the early months of 2021, we can really ramp up the way that the vaccine is administered. And so I guess we're all just sort of going to be on standby for that, but that could potentially be very, very good news for our country and trying to get to the point of herd immunity, which we desperately need. As far as other supplements, I think there's been a lot of information about different vitamins and supplements, the other nutritional things that you can do. I think generally speaking, vitamin C and D, but especially vitamin C, is very safe to take. It's really has no negative consequence, vitamin C. There's really no such thing as overdosing, for example, on vitamin C, because it's excreted in your gut, and it's water-based, so it doesn't get retained in your body. So that's a good thing. So there's been some evidence that taking high-dose vitamin C in patients who have coronavirus has been effective. I think there's been some evidence with vitamin C and D in reducing ventilator time for patients who have severe coronavirus infections. So just kind of keep that in mind. I actually have taken vitamin C kind of regularly just to be safe. It helps boost your immune system. So it's something that you could consider doing. I want to caution strongly against, and this does not just apply to the spinal cord community, but everybody. I want to caution against taking some of the medications that have been put out there for prophylactic uses or preventative purpose. Obviously, you've heard about hydroxychloroquine, and that's the first one that comes to mind, just because of mixed messaging out there. Just want to be careful that you don't necessarily go out there and try to self-treat yourself, because truthfully, even to this point, there's no definitive treatment for this virus. Usually people will get better on their own, and if not, the management is supportive management. So trying to help guide patients through the recovery process. There is no definitive treatment. In the case of drugs like hydroxychloroquine and some others, there's been some evidence of improvement in certain population, but overall it's very much not regulated, and the evidence is just not there from the scientific community. So please be careful with trying to do those things. I think there was a question asked, so I'm going to answer that. Why so long to distribute the vaccine? It takes a long time to be able to ramp up the amount of vaccine that is needed for this country as over 300 million people. So I think, I'm not a government official, and, I'm not directly involved with what exactly is happening, but what will likely occur is that the first people who receive the vaccine will be, I think, healthcare workers and the most at risk. So as patients who have spinal cord injuries, you may be included in that category of being immunocompromised. And so it's possible that maybe you'll have earlier access to the vaccine than others. I'm not sure. But overall, the reason it's going to take a long time, I believe, until the country is back to normal and we can go outside and feel comfortable without masks, I believe is because even if you get the vaccine and I get the vaccine, we can't be resting assured that everything's going to be okay and that we won't be at risk of transmitting to others until, I believe, around 70% of the population of the country gets the vaccine. And so it's going to take months until we can effectively get the vaccine out to that many people. And there are a lot of individuals who are very hesitant about taking vaccines to begin with. Probably even more so in the case of coronavirus, just because, again, there's been a lot of mixed messaging about who to trust. But based on the results of the vaccine trials, I can tell you for myself, I feel very, very confident that from what I'm hearing, that when these vaccines come out, they're very safe. So I will definitely be taking it the first chance that I get, and I recommend that you do the same. But the reason it will take time is because we need so many people to get the vaccine, develop an immune response, and then we can sort of get to this herd immunity point where enough people are immune to COVID that even the few people who haven't taken the vaccine won't get it anymore because everyone around them is no longer spreading the virus. So that's sort of the logic. So it's a very unprecedented time, and I'm just trying to give you the most information that I know. Let's see, there's some more questions. I think that's about it for me in terms of what I wanted to say. As Ariani said, you guys have any additional questions for us?
I just wanted just to answer. I will double check if we have a link for breathing exercises, but if we don't, I will make sure to put that on our website, and I'll do an email blast as well, just so people can have them.
Oh, one more thing I should say is some of you have already taken advantage, and I think with the telehealth option when you're following up with your providers, with your doctors, and it's really can be really, really useful in this time. So if you don't think you need physically to be evaluated for anything, if you're not having a problem with your skin, or you're not having a musculoskeletal or neurological issue that needs to be examined, it's a really good time to do the video visits. And we can still take care of different things that you need, like having paperwork done and forms and whatever else that you might need. So video visits are coming into style now, but I actually think that's something that's going to stick. I think COVID situation and the pandemic has made us rely on this more than ever, but I do think we've actually learned that this is a very viable option for the future, even when things are normal again. That there's a lot of benefit to sometimes reducing the travel and the cost and the interpersonal, in person-to-person communication. So take advantage of the video visits if you think that that's appropriate for you as well.
All right, I guess any other questions, comments? All right, so I guess we're gonna end it there then. Thank you so much, everyone, for joining us. I'll make sure that this recording is also available on our website and the slides as well. But if you want, I can personally email them to you. So just share your email and I will make sure to do that. So, all right, hope everyone has a safe and healthy holiday.